Good afternoon, folks. This afternoon's topic A is we're discussing legislation that lawmakers are proposing a fall prevention bill that prioritizes preventing slips and falls among seniors. So that is today's A for you. Here we go. Is more than a feeling good measure. It's a public health intervention with a huge downstream impact. Falls are the number one cause of injury related deaths for seniors, for adults over 65. And Pennsylvania mirrors the national trend. But here's the landscape and why legislation like this matters. Why a fall prevention bill deserves priority. Takeaway: a strong fall prevention bill reduces hospitalizations, long-term disability, and Medicare costs while helping older adults stay independent longer. The core reasons is it's urgent. Hidden fall risks: poor ankle mobility, weak hip stabilizers, neuropathy, and vision decline often go unnoticed until a major fall occurs. Home hazards: loose rugs, poor lighting, cluttered walkways, and slippery bathrooms are responsible for a large share of preventable falls. Rising medical costs: hip fractures alone can cost $30,000 to $50,000 per incident and often lead to permanent loss of independence. Aging in place pressures: more seniors want to stay in their homes, but without safety upgrades, the risk skyrockets. What bills like this usually include? Home safety funding, grants or tax credits for grab bars, railings, non-slip flooring, and better lighting. Community balance programs, Tai Chi, strength training, and mobility classes, proven to reduce falls up to 40%. Medical screenings requirements, annual fall risk assessment, gait tests, and medication reviews. Support for caregivers, training on safety transfers and home setup, and early warning signs. Why lawmakers often support it. Bipartisan appeal: fall prevention saves money and improves quality of life without ideological baggage. High ROI: every dollar spent on fall prevention programs can save 3 to 5 in medical costs. Rural relevance areas like Meadville have older populations and limited hospital capacity, making prevention essential. What can you do next? If you're thinking about how to frame this issue for others, neighbors, local officials, or community groups, I can help craft a short, persuasive message, a fact sheet, or a talking point list. Here's a polished publication, ready op-ed written from your perspective, making the case that lawmakers should prioritize fall prevention. Okay, here's the rest of the presentation for A, guys. Time to prioritize the fall prevention bill and protect our seniors. Every year, thousands of older Americans are rushed to the emergency room after a fall, an incident that is often dismissed as an inevitable part of aging. But falls are not inevitable. They are predictable, preventable, and devastating. They also are the leading cause of injury-related deaths for adults over 65. That is why lawmakers must make the pending fall prevention bill a top priority. This legislation isn't just another line item in a crowded policy agenda. It's a lifeline for millions of seniors who want to age safely and independently in their own homes. It is a relief valve for caregivers stretched to their limits, and it's a smart investment for taxpayers who shoulder the enormous medical costs that follow preventable injuries. We already know what works. Evidence-based programs, safe home safety assessments, grab bar installations, balance and strength training, medication reviews. And community mobility classes reduce falls and risk dramatically. Yet, access to these interventions is uneven, especially in rural and aging communities where older homes and limited physical therapy options compound the danger. A strong fall prevention bill would close these gaps. It would fund home modifications that make daily life safer. It would expand community programs that help seniors maintain strength and stability. It would support clinicians in identifying high risk medications. And it would improve data tracking so local agencies can intervene before a fall occurs, not after. But there is An uneven or even more urgent reason to act. The hidden risks we rarely talk about. Research shows that issues like poor ankle mobility, foot structure changes, and medication induced dizziness are major contributors to falls. These are not problems solved by telling seniors to be careful. They require targeted screening, trained professionals, and coordinated public health strategies, exactly what this bill would support. The economic case is equally compelling. Falls cost the US more than 50 billion each year in medical expenses. Preventing even a fraction of these injuries would save lives and reduce strain on Medicare, Medicaid, and family caregivers. Prevention is not only compassionate, it's fiscally responsible. We are an aging nation. By 2030, 1 in 5 Americans will be over 65. If we fall, if we fail to act now, we will face a wave of preventable injuries that will overwhelm families, hospitals, and long-term care systems. Prioritizing prevention is an optional, not optional. It is a moral obligation. Our seniors built our communities, raised our families, and shaped our future. They deserve more than reactive care. After a crisis, they deserve proactive protection that keeps them safe, mobile, and independent. Lawmakers should move swiftly. The fall prevention bill is not just good policy, it is the right thing to do. Okay, guys, here's the rest of it. Quick answer. Healthcare spending for non-fatal falls among the US adults 65 reached an estimate 80 billion in 2020, up sharply from roughly 50 billion in 2015, with Medicare absorbing the largest share of the cost. that number that number reflects not only the medical treatment or injuries, but the cascading expenses that follow a fall. Emergency care, hospital stays, rehabilitation, and long-term support when independence is lost. The scale of the problem. Non-fatal falls are one of the most expensive and least appreciated drivers for healthcare spending in America's aging population. Each year, about 3 million older adults are treated in emergency departments for fall injuries. and around 800,000 are hospitalized, often for hip fractures or traumatic brain injuries. These events are medically complex, require intensive care, and frequently lead to long recovery periods. The 80 billion estimate for 2020 comes from updated CDC modeling that applies fall attributable fracture fractions to national expenditure data. It reflects both the growing number of older adults and the rising costs of treating fall related injuries. For context, the 2015 estimate of 50 billion already represented a major public health burden. The jump to 80 billion underscores how quickly the problem is accelerating. Who pays and why it matters? Most people, or most of the spending, flows through Medicare, which covers hospitalizations, skilled nursing, and post acute care. Medicaid picks up costs for long term services when seniors exhaust their assets. Families absorb out of pocket expenses, lost wages, and the unpaid labor of caregiving. This means fall related spending isn't just a healthcare issue, it's a household budget issue, a state budget issue, and a federal budget issue. Every preventable fall avoided is a direct savings to taxpayer and families. Why spending keeps rising? Several forces push the total upward. Demographics. The US population over 75 is growing rapidly, and fall risks increases sharply with age. Higher treatment intensity. Modern trauma care saves more lives but is expensive. More medically treated falls. Seniors are more likely to seek care than in past decades, increasing recorded spending. Post acute care dependence. Falls often trigger long term rehabilitation stays or permanent functional decline, which drives long term care costs. The CDC, the CDC updated methodology also captures more of the true cost burden than earlier models, contributing to the higher estimate. Where the money actually goes. Emergency and inpatient care, imaging, surgery, and acute stabilization, rehabilitation, physical therapy, occupational therapy, and skilled nursing, home health and long-term services, particularly after hip fractures or head injuries, indirect costs, caregiver time, reduce independence, and loss of productivity, costs that are not fully captured in the 80 billion figure. Prevention, the highest value in investment. The the encouraging news is that fall prevention programs consistently show a strong return on investments. Evidence-based interventions include strength and balance training, e.g., Tai Chi PT led programs, home modifications such as grab bars, improved lighting, and non slip flooring, medication review to reduce drugs that cause dizziness and sedation, foot and ankle assessments, since mobility limitations in these joints significantly increase falls. Vision and hearing correction, which improves spatial awareness and balance. Communities that scale these programs see fewer hospitalizations, lower Medicare spending, and better quality of life for older adults. What, what the numbers don't capture. Even the 80 billion estimate underscores the true burden. It excludes the emotional and physical toll on caregivers, loss of independence, and reduced quality of life. Long-term long-term disability costs that extend beyond the first year after a fall. When these are included, the societal cost of non-fatal falls far higher than medical spending alone. Okay, guys, that is A for you. I will try and do B in a few minutes. Give me a bit to set that up, and I'll have that for you shortly. For now, Gator Wellness, take care, folks.